If dopamine confuses you, stop memorizing random facts and picture four roads leaving the same city. The city is dopamine, the roads tell you what happens. Road 1 is the mesolimbic pathway. Think reward, reinforcement, salience, and psychosis. This is the pathway that helps the brain say, "This matters. Do it again. Pay attention to it." It is not just the pleasure chemical. Dopamine is heavily involved in wanting, seeking, learning from reward, and assigning importance. Too much dopaminergic activity here is one reason we think about positive psychotic symptoms, like hallucinations and delusions. Road 2 is the mesocortical pathway. Think prefrontal cortex, mood, motivation, cognition, executive function, working memory, and attention. When dopamine signaling is not working well here, patients may look flat, slowed down, unmotivated, inattentive, or cognitively foggy. For PMHNP students, this is why dopamine shows up in discussions of schizophrenia, depression, ADHD, and substance use, but never in exactly the same way. Road 3 is the nigrostriatal pathway. Think movement. This road runs from the substantia nigra to the striatum. When dopamine is too low here, you think Parkinsonian symptoms like rigidity, tremor, and bradykinesia. When dopamine receptors are blocked here by antipsychotics, you worry about extrapyramidal symptoms, acute dystonia, akathisia, Parkinsonism, and with longer exposure, tardive dyskinesia. So when a patient starts an antipsychotic and then says, "I feel like I cannot sit still," dopamine should be flashing in your mind. Road 4 is the tuberoinfundibular pathway. This one is the exam favorite because it sounds complicated but is actually simple. Dopamine inhibits prolactin. So if you block dopamine, prolactin can rise. That can mean galactorrhea, amenorrhea, sexual dysfunction, infertility concerns, or gynecomastia. In plain language, dopamine is the brake on prolactin. Take off the brake, prolactin may go up. Now connect this to meds. Antipsychotics often reduce dopamine activity at D2 receptors. That can help psychosis through the mesolimbic pathway, but the same D2 blockade can create side effects in the nigrostriatal and tuberoinfundibular pathways. Stimulants increase dopamine and norepinephrine signaling, especially in circuits involved with attention and executive function. That is why dopamine matters in ADHD, but again, not as a cartoon reward chemical. More like a signal that helps the brain prioritize, initiate, and stay engaged. So here is your shortcut. Mesolimbic, reward and psychosis. Mesocortical, mood, cognition, attention. Nigrostriatal, movement. Tuberoinfundibular, prolactin and lactation. If you remember nothing else, remember this. Dopamine is not one thing. Dopamine is location. Same neurotransmitter, different pathway, different clinical picture. Save this before your next psychopharm exam.